Non-melanoma skin cancer is the sum of tumors including Merkel cell carcinoma, basal cell carcinoma, and also cutaneous squamous cell carcinoma. The conference and the communication today will focus on cutaneous squamous cell carcinoma. And we have, for all the three tumors I have mentioned, now new standards of care. There is no chemotherapy in first line for these patients anymore in the locally advanced and metastatic setting. All these patients will get a checkpoint blockade. For Merkel, we have Avelumab, which is approved, and for advanced basal cell carcinomas, we have hedgehog inhibitors and Cemiplimab as the checkpoint inhibitor in question, and also for the cutaneous squamous cell carcinoma, we have Cemiplimab approved. So what we see is that patients in clinical studies, roughly 50% of these patients are benefiting from this kind of treatment, have also long-term tumor control, and this is quite meaningful because many of these patients are quite old, have a lot of comorbidities, and tolerability of this of these drugs is very good. So you are extending tumor control and potentially curing a number of these patients. I think what we have learned over the last years is that obviously roughly 50% of the patients are not benefiting. So this is one of the unmet needs for these patients. How do we overcome PD-1 refractory states? What can we offer those patients? And there are a number of clinical trials ongoing currently testing combinations, trying to improve and to overcome PD-1 resistance. So that's not over. That's still in the clinical trial, so we have to wait. And then there is definitely another challenge we have to tackle, and this is that many of those patients are immunosuppressed. So they have previous organ transplantations, or they have diseases which require long-lasting immunosuppressive treatments. Or, and there's a third group who have underlying hematological diseases like leukemias and lymphomas, which is also associated with immunosuppression. So we know that checkpoint blockade in those patients are either not indicated or not working as good. So we need additional ways to combine to overcome this persistent immunosuppression. Also something which is still in clinical trials and will take some time to develop.